Hello, my name is Catherine Rutland. I am Clinical Director for Denplan and Simply Health. Very lovely to be speaking to some of you again. I appreciate it's some months since I last did a podcast. I realised looking at the date of my last one, I realised that everybody was back at work in some shape or form and lots going on and very busy and didn't seem appropriate to be to be continuing to update. So, but today, as we certainly in England go back into lockdown again, it seemed for many different reasons that I'll go through as I talk, it seemed relevant to speak again and just record this little podcast. I appreciate for those of you in the devolved nations, things are different. You've already been in circuit breakers or however you want to call them, or different tier levels. I think we are all in some shape or form of restriction, and obviously months and months down the line, in lots of ways it's become more normal, but that doesn't make it easy still. And I think that's where I wanted to start, really, is that awareness of how difficult it still is. I appreciate that some things are a little bit easier this time around. We are more used to it, that's for sure. We are more understanding and probably more realistic. Our expectation of time spans and how long things will go on for is very different to what it was earlier in the summer. But actually, sometimes we still have to stop and say, yeah, but it's still tough, and it's going to affect everybody at lots of different times. Personally, for me, last lockdown I spent it completely on my own. So this time I have my daughter home. She was in South Korea over last lockdown, so nice to have her back, and a crazy 5-month-old puppy who certainly keeps me busy and reminds me of the positives in life. So, but it is difficult, and I still felt myself last night feeling very odd and very weird, and bringing back lots of those memories of last time we went in and the consequences of that. And we do need to be mindful of that for ourselves and for our teams, and look after each other. So that's the first thing I want to say is please look after yourselves and accept that this is tough, and make sure that you're looking out for those around you as well. I think one of the big things is that I'm seeing within practices is the difficulty now sometimes of taking as much break as you want. There isn't we still haven't got the luxury of booking time away, and even if we have, it might be changed. Still, that's the case. So many people booking sort of more local travel, and it's still been cancelled. I was supposed to go to Cornwall tomorrow, and obviously that's now off, and so many people in that situation, and so we're not getting the sort of full proper breaks that we really need. So please be aware of that, but still do make sure that you get your time and your staff get that time as well. It can be easy to think, well, I can't go anywhere, I can't do anything, but actually just time out is still so important for our mental well-being. And to make sure we maintain that work-life balance that I know for all of you at the moment is really tough. I think from a positive perspective, the fact that dentistry is open this time around is brilliant in all jurisdictions. I know some jurisdictions you have never closed down completely, but it is nice this time that there is a much more positive stance to the fact that people do need to attend healthcare generally, and certainly dentistry, and that it's really important. Everything's done. It would have been crazy, in my view, personally, for them to shut us down. Everything's in place, the PPE, the safety checks, enhanced infection control, all of those things that we're always so good at doing are in place and there to protect yourselves and your staff and your patients. So I think that's really good. And on that note, I think it's really important that message is reiterated to patients. I think I've seen some really great messages this time from so many practices, either by email or little video clips on Facebook, whatever it is, going out to their patients and stressing the fact that that they're still open and they're still there. And can I really encourage you to do that? There's so many mixed messages for the public out there about healthcare, and there's still a lot of fear and still a lot of worry, and it's just so important that you share, whether that's through your social media channels or direct your patients. But please keep doing that. It really is important. Some of you have opted to have your fee rate mailing letters go out at the moment. So again, important while those letters are landing and over the next month when the next tranche does, that the patients really understand you are still there for them, the value of what they're getting, and how important it is to continue and maintain their oral health through this period for so many reasons. And that leads me nicely into Mouth Cancer Action Month, which is this month of November. It's our 20th year of supporting the Oral Health Foundation with this month. Many of you have been fantastic supporters of it over that 20 years. And it is something that this year, of course, we're having to do very, very differently. We have normally had a launch at the House of Parliament to raise sort of parliamentary awareness with MPs and so on, to get the message out and to make sure they do that. Of course, we aren't able to this year. So what we have done instead is written to a big selection of MPs to stress the importance of Mouth Cancer Action Month, to getting messages across to their constituents, but also reiterating that message, as I said earlier, about dentists are open, please go. It's important to get checked out. So can I ask that you all get involved in that as well? It is, as I say, different, but there are lots of things. We have a series of webinars running through this month. Nigel Carter started the first one on Tuesday night and had over 1,300 registrants. So phenomenal to see that, and watching it, to see how many questions came at the end. To me, that's always a good indicator of the fact that people are listening to you, if there's lots of questions afterwards. So great on that. Those are running through November, so it's not too late, and you can go back into them obviously and watch them. There's a mixture. We thought that having mouth cancer fully through that would be really quite hard and tough for people to watch, and lots of similar messages, so we have shaken it up a bit, and there are some different subjects in there, but around prevention generally. So please do have a look. That's in line with Dental Update and Oral B as well. So really great series of webinars. Please do have a look and get involved. You can also have a look on Simply Select or the Oral Health Foundation's website for useful materials for your practice. So obviously, again, we're conscious of this year that you're not going to have the same throughput of patients, or you can't necessarily communicate in the same shape or form. So big way, obviously, easy way of communicating is through social media. So we've developed lots of posts for that. And I really I can't ask you enough and stress enough. I always feel very passionately about it. It's something that we know is as a cancer is growing, and we have such a significant part as a profession to play in early diagnosis and prevention, and this year more than ever feels like to me, because patients haven't been seen, and we know patients don't necessarily even particularly flag that it's an issue or that it's important enough to come to see you if they've got any of the signs that we would be looking for. So please encourage them in and encourage to get those messages out. We will be doing a radio day, which we always do. We were going to do it today. I'm recording this on Thursday the 5th, but we decided there were a few little things going on that were possibly going to absorb the press today. So I think that's good for us to delay it a couple of weeks, but we will then get Nigel and I will be doing that session where we'll talk to a lot of radio gosh, my brain's gone dead, radio programs across the country, and really start spread those messages out to patients as well. So if you could be involved, be really grateful. From a Denplan perspective, lots going on, very busy, looking at lots of different areas, and it does feel nice to be working forwards now. We have our series of virtual forums coming up for our members towards the end of November. Please do come to that. Lewis, Mackenzie and myself will be doing a clinical and professional update, and then Pam Whelan, our Director of Sales, will be doing a sort of company update. So for those of you who want to know where we are, see that we still exist, even that we don't just have voices, that we are still alive and well, then please do sign up for those, and submit any questions and so on beforehand. Speak to your consultant if you haven't seen anything about that. The planning for next year is continuing. We're looking, it's a constant moving feast, as you all know, as to what we can do, what we can't do, and how we work forwards. And we are working and adapting constantly to those changes. As ever, always grateful for any of your feedback, any of your thoughts, and really just want to say again, please do keep well, please do look after yourselves, and I'll speak to you soon. Thank you. Bye-bye.